Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. You're invited to join us on air, asking your questions by calling in on the local rate phone numbers in the UK and the US, which can be found on ldnradio.org. Thank you for joining us. Today we're joined by Dr. Laurie Marzell, and Laurie is from Oregon. She's a primary care physician, and we're excited to hear her story. Dr. Laurie Marzell from Oregon is a primary care physician that combines the wisdom of naturopathic medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimum health by creating a healing internal and external environment. Call 503-655-9493 or visit the website www.drmarzell.com. Thank you for joining us today, Dr. Laurie Marzell.
It's a pleasure and an honor.
Thank you. I know our listeners are always interested to know the background of doctors. What made you decide to become a doctor?
I was just fascinated with, I was one of those strange kids that liked those little kits that put livers together and body parts, and I just was fascinated with the way the body worked, and I loved biology, and I started studying about plant medicine come from, and I was just fascinated with things, and so I started going in the direction of medicine and natural medicine, and that don't require harmful drugs, looking for things like that. So I became a naturopathic physician, and we are in Oregon primary care physicians as well as specializing in natural therapies.
Mm-hmm. And how long have you been practicing?
It's over 30 years.
Wow. That's a long time, isn't it?
A long time.
It is a long time. And how long have you been prescribing LDN?
I'd say maybe about 10 years. And would you like to hear the story of how I became involved with learning about LDN?
Yes, please.
I knew that LDN was used for cancer patients, but in my practice, I was not really seeing a lot of cancer patients, and I occasionally used it for arthritis or something like that, but I wasn't that familiar with it. And a very close friend of mine developed cancer and decided to come back to Portland to be with her family. She had gallbladder cancer, and it had spread throughout her body, and she came back to die, essentially. And I wanted to do everything that I could possibly do to help her. So I referred her to a doctor a naturopathic doctor I thought would be a good place to send her, who specialized in cancer patients. Well, she came back after seeing this person, and he told her about good diets and that, and I was reviewing everything I could find, and I called him up and I said, "Are you using Naltrexone?" And he said, "Well, no, I can't really use that. I'm a part of a group, a hospital group, and I have certain restrictions." And so I said, do you want me to prescribe it? And he said, yes. So I did. And this particular woman was not in a lot of pain, but she was very, very fatigued. And she had to sleep a lot, and her energy was low. And she, again, I wanted to do anything I could to help the quality of her life as long as possible. I started her on LDN, and I was absolutely amazed with the results because within just a few days she started perking up. She was happier. She was more talking to people longer. As a matter of fact, I have to joke around that I and another friend of hers took her out to lunch one day. She decided she wanted to go to a restaurant that was way down the street, blocks and blocks away, and we said, well, it's so far, let's try and park the car. She goes, no, let's just walk. And we ended up walking. As a matter of fact, she was walking so fast that we couldn't keep up with her. Mm-hmm. Anyways, it was, it didn't save her from the cancer she had at the stage she was in, but it made a huge difference. And when I was interested in using LDN, I started doing research on everything I could get a hold of, particularly involving cancer cases. I read some fascinating cases that were published by Bert Berkson. And when I found out about the low-dose Naltrexone Research Trust group, and that they were doing seminars every year about this therapy, I was very, very excited, and I attended my first seminar. And I actually met Dr. Berkson in person, who was kind enough and generous enough to come and share his knowledge and his experience in treating cancer patients. And I spent probably over an hour personally talking to him about this particular case and other questions I had, and it was very fascinating. So I am very, very grateful, Linda, that you have maintained this group and put on these seminars, because every time I go, I learn so much. Anyways, I went back to my practice, which, even though I don't see a lot of cancer patients, I do see a fair amount of autoimmune cases and pain syndromes and arthritis and things like that. And it just seemed like almost LDN is so multi-helpful for cases. You can use it for so many different things. And that I just started using it with lots of different patients. So, of course, the seminar I went to had experts in using it for pain syndromes and for gastrointestinal inflammatory disorders and just all kinds of conditions. So I learned a lot, and I've found this therapy one of the most helpful therapies that I use in my practice now.
Mm-hmm. What would you say is the most common condition that you treat with LDN?
You know, there's so many. Every time a patient complains about pain or inflammation, I think about LDN. I think it's good for fibromyalgia. It's any kind of autoimmune disease. I think about LDN. If you like, I could just tell you about a few cases that I've used it in and what kind of results I've gotten from it.
That would be good. Thank you.
One of the most interesting cases that I used for pain was a woman who had a spinal tap done, and it was botched, and she had permanent damage. So she was in constant chronic pain. And I thought, well, let's give this a try. So we started her on LDN, and after a short period of time, I asked her how it was working and if she was noticing any difference. She still had pain, but it has decreased 50%, which is absolutely remarkable because she was left with absolutely nothing to do about this condition. I've used it with, I had a patient who was had multiple allergies and thyroid autoimmune disorder. And she would come in and she'd say, I want you to check me because I feel like I'm starting to choke. I feel like my thyroid is swelling up. And I would always run all these lab work on her. And she was okay, but she knew that something was wrong, and she could feel things, and she could feel reacting more easily, getting sick more easily. So I started her on LDN. We talked about it quite extensively, and she said that she was willing to try it. And she said within a few weeks she noticed a difference as well. She says, I can, that swelling and that discomfort I have, it's gone. Wow. She's not getting sick as easily. Her allergy reactions weren't as bad. It was very, very helpful. I had a patient who has, she is still with us, and she has lichen planus. This is an autoimmune condition. It manifests with a rash in oral mucosa and sometimes genital mucosa as well. And again, there's not too much this is a very difficult to treat condition. And I went ahead and tried the LDN, and it started clearing things up and decreased the swelling. The rash started resolving, and the patient felt better. So that was a big win, I thought. Mm-hmm.
Definitely.
What I tell my patients with using low-dose naltrexone is, of course, a lot of my patients come in and they want natural therapies. They don't want heavy drugs. So I tell them that the low-dose naltrexone stimulates their own endorphins and their own hormones. And the hormones that they are producing in their body is what is doing the miraculous healing. It's not the drug itself. The drug's just using to stimulate their own body process. And they kind of like that idea. Mm-hmm. And then I talked about how important low-dose naltrexone is to, and what kind of effects it has on the immune system, which is relatively new information, that it can actually stimulate the immune system to fight things that we don't want, like viruses, and it can stimulate the immune system to help get rid of cancers, but it can also stimulate the immune system in a way to settle and not be as reactive, like in autoimmune disorders. We don't have a lot of really good therapy, I don't think, for autoimmune disorders, at least not from conventional medical approach. So this therapy, I am so grateful for learning about this. And the results I'm seeing from using it's not a total miracle drug, but it certainly is extremely helpful. So I'm very grateful, and I'm very grateful to you, Linda, for providing so much information to the world.
Oh, thank you. I know our listeners, everybody asks the same questions and they come up over and over again. So from your experience, what dose do you start your patients on?
Usually about 1 to 1.5 milligrams. And I usually, the general dose I aim for is about 3. Mm-hmm. And it depends on their, response, but I usually start about 1 to 1.3, have them do that for about 2 weeks, and then bump it up to about 3. And it depends on the person. It depends on how sensitive they are. And I think that a good direction in prescribing naltrexone was made when the current recommendations started kind of changing from having patients take it before they go to bed, which adds on to an already bump-up effect from the patient's own endorphins during the night, which can, some of my patients were waking up and they have very weird dreams and their heart would be racing and things like that. But if they take it in the morning, it seems to, even though it's suppressing endorphins for about 4 hours, it doesn't seem to drag out people or make them groggy or anything like that. And as the endorphins wear off and their own endorphin, or the endorphin suppression wears off, and their own endorphins start climbing up, I tell people, you know how the 3 o'clock you get tired and groggy and, kind of lose energy? Well, you'll notice yourself suddenly feeling, refreshed and happy and energetic. It's almost like a little cup of coffee and a pill or something. But it has taken away a lot of the hyperness that some patients do notice. So I had an unfortunate, maybe I'll tell you an unfortunate story too. I had a patient who I thought this would be an ideal therapy for, who has fibromyalgia. And I explained to him that if he took it before he went to bed, he would have an additive effect to his own rise of endorphins during the night as the blockade of the endorphin receptors wore off, and that would help him throughout the day to suppress the fibromyalgia and inflammation. So he took it before he went to bed. He only took it a few times. He had a terrible nightmare about a raccoon attacking him. And he decided that he was never going to take that again, and it was really unfortunate. And I think if I had been a little wiser and had him take that in the morning dose, he may not have had such strange dreams, frightening dreams, and he may have stuck with the therapy long enough to get better results from it.
Mm-hmm.
So,
another question that people usually ask, I know it's a bit like how long is a piece of string, but how long is it normally before your patients notice something?
That's a great question because it's actually pretty quick. And of course, this is good for patient compliance when they start seeing results in a fairly quick manner. But I usually see results within a week or two that results are starting to happen.
Wow, that's good. So from the patients, how many patients do you think, Laurie, that you've treated with LDN?
No, I don't even know if I can count them because it's such a good therapy that I use it with so many people. I would say maybe I could give a percentage of how many people I have. Not everyone in my practice, but so many people have problems, and sometimes I use it just temporarily. But a lot of times these are chronic problems that the patient doesn't have much alternatives that are effective for these type of conditions. So I'd say a fair 70% at least of my patients maybe I've had on low-dose Naltrexone at one time, mm-hmm. or considered therapy for them.
And have they at any point reported any negative side effects apart from the raccoon dream?
Well, low-dose Naltrexone, because of the endorphin jump-up, is noted for having strange dreams sometimes. So I kind of warn people about that. You might have some strange dreams, although taking it in the morning, I think, has lessened that a lot. I have had some people that have been very sensitive. They got a little jumpy or jittery, and so I kind of watch for that. And I'm pretty careful with thyroid because you may have to adjust the dose of the thyroid, although I haven't had problems with it personally treating patients who are hypothyroid. They seem to do fine. But when you consider the options for pain relief for patients, this is a much better one, and it affects the whole body in a positive way. So I think this is good. I've even used it a little bit with patients who are depressed or, doing something that increases endorphins for patients makes them feel happier and better, and their immune system is better, and their body function, everything's going to be better. So it's not for everyone, but it's certainly very effective for many conditions.
And of course,
I think that's the beauty of this therapy.
But if you can take something like LDN that helps you sleep better, by getting a good sleep and quality sleep is going to make you feel so much better in the morning, isn't it? You're going to feel happier, more refreshed, and able to cope better during the day. Yeah,
some people, as a bad effect, can need a dose adjustment. It could interfere with their sleep, I've noticed. But some people, as they get used to it, they do sleep better. As a matter of fact, I have one patient that calls it the stuff that helps you sleep better medication.
Oh, that's brilliant. Well, we'll just have a quick break and then we'll come back and continue. We'll be back in a moment. To listen to individual radio shows and interviews, go to www.mixcloud.com/LDNRT. I'll repeat that. It's www.mixcloud.com/LDNRT. Dr. Laurie Marzell from Oregon is a primary care physician that combines the wisdom of naturopathic medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimum health by creating a healing internal and external environment. Call 503-655-9493 or visit the website www.drmarzell.com. Welcome back. We're joined by Dr. Laurie Marzell today from Oregon, and thank you for being with us, Laurie.
You're welcome.
Another question, while I think of it, that is always on people's minds, and it seems as though it varies from doctor to doctor what the answer is. So if we could just have your opinion. Some doctors say that LDN can't be taken with Tramadol, and others will say it can be taken with Tramadol because it's a synthetic opioid. What's your views on Tramadol?
I usually try to take the patient off Tramadol if they're going to be on low-dose Naltrexone.
Mm-hmm.
And I find that I would prefer to prescribe the LDN rather than the Tramadol for the patient. Anyways, it'll do much more, have a much wider scope of helping the patient and help with pain rather than the Tramadol.
Yeah. So if your patients before LDN has worked and it hasn't quite got pain under control and they need to take something to supplement the LDN for pain, what would you recommend?
If they're already on pain medication, if it is not, my understanding is if it is not a extended release pain form or like a patch, it can be used if you take one medication, start trending it down in the morning, and then you can use start on LDN in the evening. But I don't have too many cases like that.
Mm-hmm.
So, but that's my understanding. And then as they start feeling better and have better effects with the LDN, trend down on the other pain medication.
That's wonderful. Phyllis had a question for you. She was listening about lichen planus. She says, does Laurie think there are different forms of lichen planus? Are some forms that LDN can't help with, or does it help with all forms given long enough?
No, I think it could. There's different, lichen planus can manifest different symptoms, and it can appear in different, not all lichen planus appears in genital tissue, it just varies, but it's still disease. And I think that probably I would say that most would respond to some degree for low-dose naltrexone treatment. So I would recommend using it for that disorder, absolutely.
Mm-hmm. Well, thank you. I hope that's answers your question there, Phyllis. Now, we know that a lot of people with MS have stiffness and spasms, and we have a question here from Janie who says, have you noticed anybody reporting that stiffness is a problem when they first start LDN, and do you know the cause, and is there a solution? She also goes on to say that her stiffness is the spasticity type, and her muscles and calves are an issue for her, and she's finding that, the LDN is making it worse. I'll let you answer that question. I have my own thoughts. I'll tell you that after you've answered.
You might know more than I do. I only have a few MS patients that I'm working with LDN, so I wouldn't say that I'm an expert in that area. And I personally haven't noticed people manifesting that. But your opinion is probably more valuable than mine in regards to that. I think you have a lot more experience.
Well, I will tell you from my experience, there are, when you have MS, of course, you can have a wide variety of different symptoms. But for those people that have stiffness or spasms, LDN can make them worse initially. Now, years ago, back when I started LDN back in 2003, everybody started LDN straight away on 3 milligrams, which was fine if you didn't have MS with stiffness and spasms as a symptom. It did make them worse. So these days, as you were saying, most people start on 1.5 milligram, which is absolutely fine, again, if you don't have MS with stiffness or spasms as an issue. If you do, it's best to start on just 0.5 milligrams of LDN. And normally, those patients who would normally have stiffness or spasms, because that is a symptom they already have, by taking the lower dose, it doesn't make it worse. And these people need to increase the dose very gradually, very slowly, and never increase the dose if they've still got worsening of the stiffness or spasms. They have to wait for their body to adjust and then increase it by 0.5 very slowly. And that way, people can tolerate the LDN and it doesn't make it worse. So I'm sorry to butt in there, Laurie, but that is the
I'm
experience.
So glad you did, because there's nothing like you're going through this yourself and taking it and knowing what's going on.
Exactly. We have a question now from Denise, who says, should LDN be taken with food or should it be taken on an empty stomach?
Well, I usually have people take it in the morning, and so they don't have a very full stomach when they take it, but I kind of, I don't know. I recommend in the morning. I don't necessarily tell them to not take it with food. It seems to work okay.
Mm-hmm. Yes, I think that is what my personal experience is. My experience is I've sometimes, well, I've tried taking it in the morning, I've tried taking it at night, I've had it with food, I've had it without food, and I haven't noticed any difference either way, to be perfectly honest. But I think that's probably something for somebody to experiment with. If they find it's better for them with or without, well, they can do their own test there. So we have another question for Kristin, and she says, has LDN successfully been used for recovery from CIRS, mold illness?
I guess I'm not familiar. I guess I'm not familiar with that.
No, I know there are some people that have tried LDN for mold. I wouldn't know, haven't had feedback on it, but I know they've tried it. But
I would try it because you have inflammation from a reaction, and the toxins from mold is, I would think that it would be helpful. I would think it might be worth trying. Yes.
Well, the good thing
I don't have a lot of reason. Go ahead.
But the good thing about LDN, and as I was told before I started, if it's not going to do you any good, it's not going to do you any harm. So going by that, it's worth a try if you're in doubt, isn't it? If it doesn't work, well, you've really lost nothing.
I know that it really does help with calming overreaction to, which is what kind of happens with the mold exposure. They have toxins that suppress the suppressor in your immune system, so your immune system responds more quickly and vigorously to things that it should not. And it certainly seems to calm overreactions in autoimmune disease and in allergies and things like that. So I would expect that it would probably be helpful.
Okay. And Phyllis has sent me a message here. She says CIRS is chronic inflammatory response syndrome.
Oh, I know what you're talking. I'm sorry.
That's all right.
I would definitely use it for that.
Yes.
Yes.
Wonderful. We have a question here, and from my friend Gizli from Iceland. He runs a group in Iceland, does an absolutely fantastic job. And you might not know, but a very high proportion of people in Iceland use LDN. It's really quite amazing. And he says he's asking for a relative who has fibromyalgia and MDDS syndrome. He wanted to ask kindly if you think it's safe and okay to treat a person with MDDS syndrome with LDN.
Let me make sure I know what MDDS is.
Well, I must say I don't know either.
I just want to make sure. I know we're talking to people from different countries.
I know. Let's just good old Google. We'll put it in Google and see what it comes up with. Yes, MDDS, Malte-Barclay-Cumant syndrome. Debarkcumant syndrome.
I might not.
It might be called something else in the US, I guess. I'll tell you what, we'll leave Phyllis to sort that one out, and we'll come back to it.
Okay, so this is a vestibular problem, and I am not familiar with it, so I'll have to pass on that one.
Okay, that's fine. But
although I support what you said, that it's usually does no harm but may do good.
Mm-hmm. And it would
And
certainly
I'm
help.
not familiar with this particular syndrome, though.
But it would certainly help with fibromyalgia anyway, wouldn't it?
Yes. But
Okay.
this is a rare and little understood disorder.
Mm-hmm.
I'm sorry, I apologize, but I'm not familiar with this particular syndrome.
We will have to ask another speaker another day and see. Oh, Spliss has just said it's an imbalance or rocking or swaying sensation, often felt and seen by sufferers, occurred to exposure of motion. That's what the MDDS syndrome is. We have a question for Carolyn, and she says, can sweating be a symptom, or can LDN cause sweating? Have you noticed that in any of your patients?
I have not, but I'm wondering if they take it before they go to bed at night, because I have noticed some patients that have woken up with tachycardia or, a little kind of a fear-like symptom. I wonder if it could be related to them having a little too much of a additive effect to their own surge of endorphins that would occur just in the early morning hours. But I haven't personally noticed a lot of problems with sweating from this medication, no.
Mm-hmm. Okay. And do your patients always take LDN in the morning as a rule of thumb?
I am now, I originally was telling them to tough it out and try and get used to it and take it before they go to bed at night, but I'm finding it a lot easier to start patients on in the morning, and so I start everybody, and I tell everybody to take it in the morning now.
Mm-hmm. And in your practice, do you treat children?
I don't treat a lot of children in my practice. It's mostly an adult practice.
Mm-hmm.
And you can, I'm sure that, well, I'll have to leave that for another expert in that area.
Okay, that's fine. So, rheumatoid arthritis. Can LDN be taken with methotrexate?
I don't see why not. I would say yes.
There are Dr. Jill Cattell, who you were referring to before the program started, who presented the case studies, as she actually uses, if the patient comes to her on methotrexate, she will keep the patient on it and gradually wean them off as the LDN starts to work. So that is quite interesting.
Yeah.
Another one here, which is one that was a very popular question during the winter from Emily. She's saying, would you recommend people to take a flu jab or the pneumonia jab whilst on LDN?
Yeah, I don't think the LDN would hurt that at all. It wouldn't nullify the immune system against developing antibodies or anything like that, as far as I am aware.
Mm-hmm. Okay. Neuropathy in hands.
Again, remembering that this is your own body, your own body's hormones that are just kind of surging in a little bit. It's not like the drug is doing bad things to you, or it's just kind of doing a hither to your own endorphin production. So no, I wouldn't worry about that.
Thank you. We have an interesting question here from Elizabeth, who has neuropathic pain in her hands and her feet. And she said that she's been taking LDN 4.5. She started on 3 and worked up, and she'd been taking it for 3 years. It was working, and now it has stopped. she's not getting the great benefits that she was getting. What's your advice?
This is a good question because I have a feeling that I would like to speak to some other doctors about this because I have a feeling that sometimes the body kind of adjusts. And I wonder if in cases like that, maybe manipulating the dose down or doing, a little bit and then kind of pulling it back up might help get it up to where it's working more effectively. I think I've noticed that with some patients.
Mm-hmm.
But I don't have an absolute answer, I'm sorry to say.
That's okay. That's okay. Louise is asking on behalf of a friend who has Parkinson's disease, a hand and arm tremor. Would LDN work?
I don't know that it would work for that. And I'm not a neurologist. I'm sorry, but what do you think, Linda?
Well, I have actually interviewed people with Parkinson's who take LDN who have some fantastic stories to try. So my advice would be to go and ask an LDN doctor if they would prescribe LDN for you. Certainly worth trying. And if you look on our Vimeo channel and put in on the search bar Parkinson's, I think there are about 4 interviews there of people sharing their stories. And it's great, isn't it? If you've got a condition that you probably don't know anybody else with the same condition, that you can hear somebody's story. Rather than reading it, you feel more connected to that person when they're talking. So sharing stories is always very beneficial for everybody, I feel.
That's how we learn.
Exactly. So I have another interesting question here from another Laurie. She says that she's a CRPS patient. It's a very long question, so I'm just going to get to the chase. The LDN controlled the pain by 95%, and she was feeling absolutely fantastic. She stopped LDN before she had surgery, and the pain got worse, and she resumed it 3 days after, but it took her a month to get back to the level of reduced pain that she was on before. Now she's got to have surgery again, and her question is, and this is what she says in her own words, is it absolutely necessary to go off LDN before surgery? She says, I don't take opioids after surgery. Does she have to stop? Because just by stopping it for 3 days, it took 3 months for her to get those benefits back.
If she takes pain medication for having the surgery and takes LDN at the same time, the LDN will block the pain relief from the medication if she has to take that. But I don't know what kind of surgery she has to have, but a lot of times people really don't need to take that much pain medication.
She's saying she doesn't take opioids after surgery, so maybe it's something she should discuss with the anaesthetist, the hospital, or the LDN prescriber before she goes. But I would have thought the hospital would probably be able to talk to her about pain relief should she need it, with it not being an opioid. Do you think?
Yeah, and I'm kind of thinking that maybe the LDN would be, I don't know why she would have to stop it before the surgery. Mm-hmm. Maybe it depends on the surgery, and I definitely think it requires, because she's got a good point. It was very effective for her, and that's what I've learned from pain experts at your seminars who have testified about this disorder. And you hate to see someone have to go through that process again. I think that she should have some inquiries with the doctor and surgeon, and I'm kind of leaning towards, if she can continue to do it as close and be off of it as little as possible. Mm-hmm. That's where I would kind of lean towards.
And she gives a wonderful plug here, and she says, by the way, Belmar Pharmacy is wonderful. So, do you use Belmar Pharmacy out in Oregon? They're in
actually in
Colorado.
In Oregon, we have many, many compounding pharmacies, and they are all fans of LDN, and you mention that to any one of them, and they go, "Oh yes, we do that. We provide that." And so I think that we are very fortunate to have so many that are available. We're kind of a quirky little state with pioneer spirited individualists, and they like to have individualized medication and compounding available medication. So we're kind of fortunate that we have several to draw from. And it's gratifying to know that people are very happy with their pharmacies for mixing up this.
Well, we'll just go for another quick break, and we'll be back in just a moment. The LDN 2017 conference will be held in Portland, Oregon, in the US, 22nd to the 24th of September. If you're unable to attend in person, we'll bring the conference to you, regardless where you live. You can participate via our live stream. Check out www.ldn2017.com for early bird discounts. The conference will examine life-changing breakthroughs for treating multiple sclerosis, Crohn's disease, colitis, autism, irritable bowel syndrome, lupus, fibromyalgia, rheumatoid arthritis, chronic pain, mental health issues, restless leg syndrome, and many other conditions using low-dose Naltrexone. For tickets, live stream, and sponsorship opportunities, go to www.ldn2017.com. Dr. Laurie Marzell from Oregon is a primary care physician that combines the wisdom of naturopathic medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimum health by creating a healing internal and external environment. Call 503-655-9493 or visit the website www.drmarzell.com. Welcome back. Well, I can't believe it, Laurie. We have only got like 10 minutes left to the end of the show. It has gone so quickly. Hello?
Hello.
I thought I'd lost you there for a moment.
Well, I want to encourage anyone who is interested in further information to avail themselves. I tell all my patients this, actually, to look at your website, the lowdosenaltrexone.org, where it is very well organized with all kinds of different classifications of diseases and use of LDN. And I also wanted to mention your LDN book that was just recently published last year, and how helpful this is for patients to read about and discover this therapy, which is tragic to me because it's so. Sometimes I get questions from people who don't have anyone in their area who prescribes this, and they obviously need it and could have a much healthier and happier life with the assistance of LDN. So I want to encourage the doctors out there, if there's any doctors listening, to educate yourself on this therapy because it is remarkable, and it's just really using the body's own endorphins to help heal itself. What a wonderful concept.
Definitely.
So thank you so much, Linda, for all the work you do.
Thank you. You're making me blush. We have a question here from Marcia, and she's saying, have you used LDN for depression?
Yes, I have. And I find that it's helpful. I do. I find it's helpful. It increases endorphins. Endorphins are happy hormones. The different things. Exercise increases endorphins. People are happier when they have more endorphins. Sometimes people just have a hard time pulling out of that. And if you do something that elevates their endorphins, they will feel better. They will feel happier. They'll be a little more awake. And, I think it's worth trying. Yes.
No, I know that.
I don't think the antidepressant drugs are so great either, I have to admit.
Exactly. And I was just going to ask, in your practice, I know that you use traditional medicine and modern treatments and alternative ideas. How do you go about treating depression? If somebody comes to you and they have been on all these awful, very addictive medications for depression, how would you go about treating the patient? Do you have alternative therapies alongside of LDN?
Yes. I use amino acids. Well, you have to be careful. Now, if a patient's doing great and they're taking medication, that's it. They're doing great. But if they want to get off, 50% of the people on antidepressant medications have low sex drive and aren't interested in having it inhibits sexual response, which isn't a great side effect. So if people want to get off of something like that, you have to be very, very careful and slowly go off of it. But let's say that they're not on a medication like that to start with. There's a lot of, I do a whole physical and evaluation, but there's amino acid therapies, which sometimes can be very helpful. And there are certain amino acids that do cross the blood-brain barrier and will have effects on the brain and mood. And so those can be very helpful to use. Some people react to food allergies in a bad way, and that can cause emotional responses. Some people have a thyroid disorder, and that's contributing to depression. I'm not a psychiatrist, so I'm going to be looking for physiological things that I can help people with. But then there's a variety of botanical substances that are sometimes helpful. Mm-hmm. So it's a matter of evaluating the patient and seeing what might work for them and, what things to look for.
And how long would it take for a person who was feeling quite depressed but wasn't actually on any other medication to start to feel their mood lifting?
Well, it kind of depends. If it's severe depression, that is a difficult situation. But some people who are kind of mildly depressed or moderately depressed, if you use amino acid therapy, for instance, the amino acid is going to be into the brain and producing a response within about 15 to 20 minutes. The person I learned this type of therapy with would sometimes get halfway through an interview and give the patient a sample of the amino acid that she thought would help them, and then she'd watch them as she continued the interview, and she'd say, all of a sudden, this, like she gave one case of a young girl who was always upset and grumpy and hated everything, and she said, by the end of the interview, I stopped midway and gave her something, and then I kept going, and she goes, all of a sudden she started smiling and laughing, and she looked outside, and she was seeing birds or something. And she said the parents couldn't believe it. So there's a lot of natural things that can really help people with mood problems. But thank goodness there are.
So amino acids, is that a tablet or a capsule? Is it a natural thing that you can... Capsules. It's a capsule. Can you buy it, or is it with a prescription?
Yeah. No, they're not prescription. They're over the counter, but, a lot of people don't know, they produce different effects, and there are some, for instance, let me just give you an example. 5-HTP stimulates the production of serotonin. Serotonin is what is increased by the antidepressant drugs, the majority of them, because they block the body's breaking down of serotonin. By the way, you should never, never, never take both of these together. But the natural, let's say that they're not on an antidepressant drug, which is a serotonin reuptake inhibitor, but they decide that they have been feeling depressed, and they take 5-HTP, like 50 milligrams. Most people kind of mellow out, kind of relax. It helps people go to sleep. Sometimes people just deal with things in a more mellow manner, and it works quickly. People will not go through the kind of withdrawal that they would with the drug. The drug takes oftentimes 2 to 3 weeks to get to its maximum use. The natural approach, you don't have to take it every day if you don't need it, and it works quickly. So, but never use them together. If anyone out there is thinking of running out and getting some of this from the drugstore and taking both, that can cause some really bad effects. But it's just an example of how it might be a little bit better to go natural route with some of these little treasures that sometimes we don't use as much as we should.
Well, when you think of all the drugs that people are given for depression and how addictive and difficult it is to get off them, I'm told I don't know what the real name is, but I've been told benzos. That it's difficult. Anyway, thank you very much, Laurie. We've come to the end of the show, and we'll have to have you back again.
Okay, thank you so much. It was an honor.
Thank you, Laurie. Thank you. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.